Pregnancy and its outcome are very, very important in one's life. When you talk about pregnancy, it's quite complex. Yes, the beginning to till end, it's a roller coaster ride. But whenever we see pregnant women coming to visit us in terms of antenatal checkups, all that they carry is one single thing: will we have a normal delivery? Yes, there is a lot of craze for normal deliveries, but the more craze they have, the less effort is what they are putting. Yes, normal deliveries are becoming difficult day by day, thanks to our modernization, thanks to our change in culture, thanks to our changing practices and our lifestyle pattern, that we do not have any flexibility in terms of our pelvis, we do not have any squatting in our daily activities, we do not have any kind of physical exercise that is happening in our lifestyle. So, to have a normal pregnancy and a normal delivery, yes, most of the time it is how you prepare your pregnancy towards the delivery. Not only that, it is about having good antenatal checkups and a positive antenatal period that will land into good normal delivery. There are certain indications for a cesarean, but there are no indications for a normal delivery. Yes, under the absence of an indication for for a cesarean, rest all have to land in a normal delivery situation. Because for a cesarean to be done, you need a reason like placenta previa, a low-lying placenta, whether it is an abruptio placenta where the placenta opens up, whether it is a pelvis that is not compatible with that head, a larger head and a smaller pelvis. It is called cephalopelvic disproportion. And any acute emergencies like baby passing motion or baby heartbeat dropping or absolutely no water for the delivery to happen. So other than these indications, rest all have to land in a normal delivery. But we are facing nowadays with a new concept of dystocia in labor. So there are difficulties after women set into labor also. This is because of a fixed pelvis, non-flexible muscles, non-cooperation, and non-tolerance to pain. Even in spite of giving epidural, the sense of pressure itself is not tolerable by women these days. So, proper pregnancy planning, proper execution of antenatal checkups, education regarding labor and delivery, proper Lamaze and childbirth education classes, the awareness of pregnancy, labor, delivery, and what all is necessary in terms of diet, in terms of antenatal checkups, in terms of your effort towards exercises, yoga, and antenatal exercises that is required for a healthy normal delivery. So if you talk about diet these days is quite devoid in nutrition. In terms of westernization, we are having a lot of high calorie foods, high fatty foods, and not good fats indeed, and lot more of junk and fast food, canned food, pesticide rich food, fertilizers rich food. So this is giving a negative impact on the quality of egg, quality of pregnancy, and the overall complications during pregnancy and labor. If you are anemic, yes, your chances of going through a normal labor are little less because you exert yourself and you get tired, and that is one reason your oxygen carrying capacity is not good. That can be one of the reason. In severe anemias, we cannot project a normal labor and you land into complications at times. Not only that, you're prone to preterm deliveries. Preterm deliveries, indeed, most of the preterm deliveries land into sections. It is only term deliveries that you think about a normal vaginal delivery. Any reason that precipitates preterm deliveries can precipitate an operative delivery. About diet, you should start your diet preparation with a good dietitian who gives you a balance of calories, protein and fat, including your other nutrients, multivitamins and fiber. So this is really, really important. Along with a doctor in your antenatal period, you should always consult your dietitian who will be able to assist you with your body mass index, what amount of calories are correct for you. If your BMI is less, how much you should eat. If your BMI is more, how less you should eat and what are your choices. That is the route for the best pregnancy outcomes. Once diet is of good health, your exercise partner comes in. We always stress on yoga, physical nice exercises like walking, stretching and little bit of jogging is also not bad. Other than that, you have yoga, which is very much proven to give beneficial effects in pregnancy. We have antenatal yoga classes that run very frequently so that you practice these asanas and all these things which give good stretching and strength to the pelvis. Not only do they give that opening that is required for the delivery, they also give strength for the delivering mother and a good motivation. Along with the antenatal classes, you also learn childbirth education, wherein a mother is prepared for childbirth. There are a lot of apprehensions. There are people who get scared for labor pains. Labor is not too bad. Pain is something very subjective. You think twice about something painful, the pain doubles. If you do not think much, the pain is lesser in terms of that sensing. So that kind of education is important to the couple. They should be motivated and both of them should have the ideology of going hand in hand. It is not always the pregnant woman who is pregnant. It is the couple who is pregnant and they should together take into these classes, and husband should support all strengthening exercises and positions that are helpful for the pregnant woman, and during the exercise routine his presence will make a lot of difference. And husband presence during labor also gives a lot of strength to the woman, and that positive attitude that both run together is giving good results. So diet will help, exercise will help, childbirth education and Lamaze classes are very helpful. To prepare yourself for a normal delivery, you should always think positive. There are a lot of social customs and traditions that hindering the normal delivery in this part of the world, because we think that days are auspicious and inauspicious. There is nothing called an inauspicious day for a delivery of a child who's coming into the world to see you. So there are customs, and deliveries around a certain period are not good, and the planetary positions are constantly checked, and women are scrutinized for a good time and good labor delivery date and timing. So this is taking away the right of an obstetrician and the right of a pregnant woman to choose her own delivery time when it comes. So when it comes to customs and rituals, they are planning cesareans well in advance, or they are planning deliveries well in advance, which are causing hindrance and landing into more number of cesareans. So this practice has to be contraindicated, and the right time for delivery should be decided by your doctor and by your body, rather than you or your social relatives or any customs, because that is causing a lot of chaos in terms of management. Nobody can deliver in 1 hour normally planned at any given point of time before the planet changes. So that attitude has to change. Women should have the freedom to deliver when they are at the right time to deliver. And delivery practices have changed over a period of time. Nowadays, there is obesity, there are metabolic problems, there is diabetes, hypertension, growth retardation, blood incompatibilities, precious pregnancies, cervical incompetence, water leakage, low water levels, high water levels, diabetes. All these things are anyways manipulating your internal body self, wherein your obstetrician is trying to give you good results and trying to counsel you for the right thing. it is an immense difficult task to do an obstetric job with the adequate counseling. And in one pregnancy, nobody can become an obstetrician. So you have to believe a person, a senior person like your obstetrician, and put your life into her hands. Nowadays, with lot of Google and lot of exposure to information, pregnant couples take their own decisions, take their own self explanations, and do not leave anything for the obstetrician to decide on. So information is not correct. We are there to filter information and give you the right information which is useful for you at that moment, for that pregnancy and that time of pregnancy. So that is how doctors are, to give that clinical judgment which is individualized treatment for you. Nothing is generalized. So your friend has gone through something, you will never reach to that, or you will never go through that, because you're a different individual. So you should not compare basically your pregnancy to any other pregnancy. Comparisons have made pregnancies difficult these days, and that comparison has increased fear over pain. If your friend says that she had a painful delivery, you experience that pain from the beginning of your pregnancy to the end of your pregnancy without even having that pain coming into your life. So that is what is not required. So normal delivery pains are to be experienced at that point of time when you get, and your body will deal with it, and you will sense that pain at that time. If the pain is more, then you have painkillers. If you have still pain, you have epidural, you have all kinds of support these days. But you are not supposed to have that pain all throughout of pregnancy, thinking someday you will land into labor and it will be painful. That concept itself is landing many people into cesareans. So cesarean is also a painful procedure. It is also a major surgery. It is also having its own pros and cons, and it is not a very safe procedure if you are just planning for the sake of some pain during labor. You should give your body every chance to deliver normally, because that is how we are intended to deliver. Any different situations can be tackled different, otherwise you are destined to deliver on a normal delivery. So put your efforts into good diet, good nutrition, good physical exercise regime, good antenatal classes which teach you good things, which give you stress relief, which relax your apprehensions. Go through Lamaze classes which give you labor and childbirth education, which motivate the couples to have a normal delivery. And delivery day, the D-Day, is always going to come. Don't have any apprehensions about it early. You should think positive and take it one day at a time and one step at a time. There are medical procedures, there are medical support that we can give you in labor that will give the best of comfort, and a normal delivery is easier in terms if you put all the effort in your whole pregnancy. Avoid complications, have faith in your doctor, give yourself to the doctor to handle, and do not take independent decisions, and believe in yourself. Definitely you will have a normal delivery.